Here we go. All right. At this time, the meeting is recorded, and I want to introduce our guest speaker, which is Sandy Berenbaum. And the title of her presentation this evening is Lyme Families, a Psychotherapist. Did I miss something? I did miss something, Sandy.
A psychotherapist perspective.
Perspective, yes. I was talking to you and I didn't get that down. Sandy is a licensed social worker and a nationally recognized Lyme literate psychotherapist. She will share her deep insight into the emotional, relational, and practical challenges faced by individuals and families living with chronic Lyme disease. With decades of specialized experience, Sandy has become an essential partner in the healing process for patients whose illnesses, as we know, are often misunderstood, dismissed, or misdiagnosed. Her work integrates compassionate psychotherapy with a comprehensive understanding of tick-borne diseases, helping clients navigate symptom flares, family dynamics, school and workplace struggles, and the isolation that so often accompanies the chronic illness. Sandy's presentation will offer us guidance, validation, and hope, reflecting her core belief that every therapeutic relationship begins with building a team and restoring the patient's sense of possibility. I do have to share one thing. I met Sandy and her assistant Maggie in 2019 at a Lyme conference back when they used to have them on the East Coast. We were in Philadelphia. And during that time, our family was going through a lot with a family member with Lyme, a child. And she was instrumental with me. She calmed me down. Just I can't say enough good words about her, how she helped me and Maggie as well to get through that time in our life, even though I have Lyme disease. But with a child, it's so much different. So Sandy, thank you for being here. And I'm going to turn things over to you. And then once you're done presenting, we'll have some questions and we look forward for everything you prepared for us. Thank you.
Thank you, Judy. I want to say a couple of things, a little bit of housekeeping first. Those of you who know me know that I speak in run-on sentences. So I have prepared my talk. I've written my talk out because in order for me to keep it to 1 hour or 30 to 40 minutes, I needed to do it that way. So I will be reading my talk. So I apologize for that. That's one thing. And the other thing that I have to do in working on preparing this talk, I leaned heavily on Maggie, who is one of those amazing friends that I met through Lyme a long, long time ago. And she is a first-class editor. So any of you advocates that need help, I am promoting Maggie as somebody who might be able to help you. But she's my right arm. I should say my left arm since I'm left-handed. Now, I am not appearing in the screen. There is somebody's head in the screen. I don't know whether there's
We see you.
In that room.
We see you, Sandy.
Oh, okay. You see me.
Yes, it depends on the view you have on your computer.
Oh, okay. So Mary Fetter, I think, is with maybe someone, a gentleman, and I wonder if you could turn your something off so that well, how do I make myself? I want to make sure that I remain in the screen. So
there you
how do
go.
I do that? Oh,
Oops. Hold on.
You're going to do it for me?
Well, I'm gonna try. Leah, let's see. Let's see. How do we just put Sandy on the screen now?
Leah, are you still here?
You're there.
I'm here. Did I just pin Sandy? Is she now the focus?
The person talking goes on the screen. So Sandy, just talk. You're there. And we'll mute. Everybody else mute themselves.
What did I do here? So I'm talking and I'm not on the screen. What on earth did I do? So I shouldn't see me. Is that what you're saying? I thought I was going to see me. I want to make sure I could just see me as a little thing. Okay, that's all right. I can work with that. As long as I'm not distracted by movement. Okay, so uh,
Andy, if
I
you go to the thing that says view up at the
yeah,
top, then say speaker. Click speaker.
view speaker.
Yeah.
Didn't do anything. I'm still just a little thing up at the top.
Huh. Okay. Well, sorry.
Okay, well, that's all right. I don't want to waste time. So I'm okay. Um, so thank you, Judy and Kansas City Lyme, for inviting me to speak this month. It's wonderful and so very important that organizations such as Kansas City Lyme are committed to educating the public about tick-borne diseases. If you if you're able to help Judy and her excellent programming, please get in touch with her. For me, advocacy is a source of healing. I'm still not over my need to be a Lyme advocate, no matter what. And it really is a tremendous help. And Dorothy's another one of my good friends that I met through Lyme a long time ago. In fact, the co-author of our book. Now, my story began with pelvic pain, then migraine-like headaches in 1984. I went to doctors right away without getting any accurate diagnosis. I'm sure this is a story that many of you have experienced or have seen with your children, and in some cases, your grandchildren. Over those next 6 years, I was getting sicker and sicker with no one coming up with an accurate diagnosis. Of course, it came down to, I must be a chronic complainer. Implicit was, you know how it is with women. They're always thinking something is wrong with them, dreaming up symptoms for attention. One doctor gave me a diagnosis of perimenopause without him telling me how that diagnosis was even reached. One neurologist said, I must be, quote, taking on too much. What did this man that I had met 20 minutes ago know about what defined my taking on too much? My brother and I, grandchildren of immigrants, were the first in our family to earn college and advanced degrees. There were no community colleges in those days. So after some stops along the way, I enrolled in Temple University, had a 90-minute commute by public transportation each way. I took classes in the morning and had a 20-hour-a-week job in the afternoon to pay for college, graduating in 3 years. I would have understood it if a doctor back then thought that was taking on too much. Then, 6 years later, in 1990, my migraines had become daily and severe, the kind that makes you want to throw up. Actually, it makes you throw up. The day I had an appointment to see my primary care doc, a 45-minute drive from home, I woke up and noticed the beginning of a distortion of my face, a bad migraine, and extreme fatigue. I realized I could not drive the distance to the doctor's office. Fortunately, my son was home from college, so he drove me up to see my doctor. Initially, the doc couldn't find anything wrong with me. However, after I went home, he called me and suggested that severe migraines, plus what had quickly become Bell's palsy, could be Lyme disease. Would I like him to run the testing on the blood that he had just taken? Of course I did. I had the highest ELISA titer for Lyme disease that my doctor had ever seen. No question about it. At that point, however, he did not treat Lyme disease. My discussion with a friend who had Lyme, he was a physician who diagnosed himself 6 months prior, led me to the doctor who treated me, one of the pioneer Lyme doctors in the country, Joseph Barscano. I was on orals, IV antibiotics, intramuscular shots, injections for the next 4 years, and I became symptom-free. As Dr. Barscano had predicted, the last symptom to resolve were the migraines. From 1994 to date, I have not had a migraine headache. I don't remember a tick bite or a rash of any kind. My symptoms back then were all neurological and neuropsychiatric. I joined a Lyme disease support group. I highly recommend Lyme support groups for Lyme patients or people that have a loved one who has Lyme disease. I attended every month. I attended my meetings, my support group meetings, every single month for 3.5 years. I began attending Lyme conferences as well. I've never been a fan of science. Thus, I had very little background. In the beginning, I told people that I understood about 1 in 7 words of each speaker's presentation. However, even back then, I learned a lot. In this process, I made new friends. I consider the people I met and became close to as the gift of Lyme. And the gift keeps on giving. With Judy Campbell and other advocates I've recently met, new friends who understand how Lyme has affected my life. These people, the doctors and advocates, truly understood what I was going through and what I had been going through for many years. All this led to my becoming an outspoken and passionate Lyme advocate. Actually, for me, as I said before, Lyme advocacy was and is an essential part of my healing. During the early years of my practice, I was working exclusively with acting out adolescents and their parents. Gradually, I began to realize that many of my young clients had Lyme disease underlying their mental illness. I couldn't believe what I was finding. Most of the kids that were brought to me had behavior problems as defined by their parents or school. I started asking these kids about tick exposure or a history of diagnosis of Lyme disease. I learned that some had a history of diagnosed Lyme, leading to a week or 2 of antibiotics. What I came to realize was actually partially treated Lyme disease. In 1991, there was a 15-year-old who came to me with a bizarre set of symptoms. He went from being an honor student to failing everything and refusing to go to school. He had symptoms of paranoia, believing that he didn't dare love his family. He believed that if he loved his family, or if he loved someone, they would die. I approached his mother hesitantly, explaining that I was just learning about Lyme disease since I'd only been in treatment myself for about a year. I told her if her son had a severe mental illness causing his behaviors, he could be facing a lifetime of managing that mental illness. But if Lyme was causing those symptoms, it was treatable. I referred her to a Lyme literate pediatrician who accurately diagnosed her son with Lyme and began treatment immediately. This young man got well. Not only did he graduate from high school, but he was an honor student in college and eventually became an attorney. In an email that I got from him, he said that, quote, "The best thing was that he was then able to sue insurance companies." That was the beginning of my identifying adolescents who had tick-borne diseases. I learned a lot from that young man and his family. One thing I learned from this child, and many, many more to come, was that each kid is different. Their presentations of symptoms was different. Their family's reaction to checking out Lyme and pursuing long-term treatment was different. Who in their community backed these families and didn't make judgments about the approach these parents made toward getting help for their child, that was different too. Friends, even extended family members, often denied Lyme, leaving the child and family feeling isolated and betrayed. I learned to take nothing for granted, and that I needed to continue to go to conferences and learn about Lyme disease and eventually about PANS, pandas, POTS, and neurotoxic mold, anything that touched the lives of my clients who have Lyme. I learned that when there is a diagnosis of Lyme, Bartonella, Babesia, and other pathogens, that the tick-borne diseases are my primary concern. I needed to support the treatment that Lyme doctor was ordering, which included compliance with meds and probiotics. In some cases, diet and exercise. I needed to help the client or parent reach out to family and friends that understood, keeping their distance from those who did not. I learned that the diagnosis of a mental illness without a thorough evaluation for infectious diseases needed to be questioned prior to assuming that there was, in fact, a mental illness rather than an underlying medical cause of the symptoms. Early on, I worked with a 16-year-old who had been diagnosed with anorexia nervosa and had been in psychiatric hospital settings 3 times before coming to me. I accepted the diagnosis that others had made and was working with her, assuming that diagnosis, until I met alone with her mother, who put her head in her hands and said, "I don't know what happened to my daughter. She was such a happy, active child before 7th grade. Then everything changed." I said to the mom, "This is going to sound crazy, but had she been bitten by a tick around that time?" The mom said, "As a matter of fact, she was. I took her to the doctor. He sent off a Lyme test, which came back negative. So the doc told the mom and her daughter that she doesn't have Lyme. I, however, told the mom that Lyme is a clinical diagnosis based on signs, symptoms, and history, not on labs. Testing is used as supportive data. Even if the doc ordered labs, there was variability and reasons not to rely on the mainstream labs. Lyme literate practitioners use specialty labs that are proficient in tick-borne disease testing. So my client's mom took her daughter to a Lyme literate doctor who diagnosed her with tick-borne diseases. She was put on IV antibiotics, and her symptoms of anorexia nervosa disappeared, at least until the family changed insurance and the new insurance declined to continue the IV. When the IV was stopped, the anorexia symptoms returned. There were also decisions for me to make that my young clients did not necessarily agree with. A young man I'd seen when he was 15 came back to me when he was in his early 20s. He had failed out of college, and his marijuana use had escalated to an IV heroin addiction. When I asked him why he was using heroin, he said his leg pains were so great that only heroin would relieve the pain. I sent him to a Lyme doctor who diagnosed him with tick-borne diseases and was ready to begin treatment. But my client refused to sign a release for me to talk with the doc about his IV drug use. I told this young man that I was obligated to disclose the fact that he was an IV heroin user so that I didn't put him or his doctor at risk. If the doc saw IV antibiotics as the best treatment for him. When my client realized that I would tell the Lyme doc anyway, he did sign the release. He did, in fact, have tick-borne diseases and responded well to treatment. Another adolescent at risk was a teenage girl who was in treatment for Lyme, but she didn't want her Lyme practitioner to know that she was pregnant. The doc wanted to order a scan in conjunction with her Lyme treatment. Once again, I had an ethical dilemma. What do I do about disclosing her pregnancy? She refused to tell her parents about the pregnancy as well. I told her that certain tests and, in fact, certain medications were contraindicated for pregnant women. By law, she had the right to keep her pregnancy from her parents. However, I needed to disclose it to the practitioner, and I did. As I had suspected, it was handled very carefully by the practitioner, but there were to be no scans. When I start working with a client, my client and I are the beginning of a team. We expand the team to include whomever is important. Certainly Lyme knowledgeable doctors, nurse practitioners, physical and occupational therapists. With children, often school counselors are welcomed onto the team if they are willing to understand how chronic Lyme affects the education of these children. I am careful to defer to the other members of the team in areas of their expertise. That points out the importance of developing relationships with others, especially the doctors. Work with Lyme patients and their families need to be individualized. I cannot emphasize that enough. What do I know about those who call and want to work with me? Most patients or parents have been misunderstood, misdiagnosed, sometimes for many years, dismissed by doctors as they sought a diagnosis for themselves or their child. Many have spent hours and hours on the internet trying to understand what's going on with them or their family members. Some have been hospitalized, having been diagnosed with some form of mental illness. There are things that my clients have in common. They have found their world narrowing from being highly functional in families that have strong relationships with friends and extended family members until one person in their family becomes ill with a bizarre and sometimes terrifying set of symptoms. Their world becomes more and more narrow as they begin to realize how little other people know about these diseases. They retreat and isolate, not knowing who to trust. My first goal is to widen that circle just a bit, providing them with hope. Hope is my first goal. Being Lyme literate means continuing to learn, even now, after over 30 years working with Lyme patients. As I said, it is essential to continue to learn, to understand tick-borne diseases. Aside from Lyme, co-infections, PANS, and other co-conditions that my clients have, I watch for new things on the horizon that may be related. I recently became interested in the film Complicated about Ehlers-Danlos syndrome, a condition with many symptoms that are similar to Lyme. My interest was piqued by this documentary because the director was Andy Abrahams, whose first major film, Under Our Skin, was about Lyme disease. I know him to be a fine documentarian, so I signed up to watch the new film a few weeks ago. He certainly did not disappoint. This fine film broadened my knowledge of another illness whose symptoms can overlap with tick-borne diseases. Ehlers-Danlos is now on my radar. I've also become aware of the fact that many of my clients, even children, have been prescribed psychiatric medications to treat the psychiatric disorders they were, quote, diagnosed with by doctors that did not realize that anxiety, depression, and other psychiatric symptoms could be caused by their infections. Aside from the importance of ongoing learning, I believe that a vital part of my work is, at its core, building and maintaining a relationship with each client. That goes to being available to reschedule sessions, even last minute, if a client is not up to having a session on a given day or time. It may be about sleep disturbances, or inability to focus, or physical pain. But I never accuse them of making excuses or lying. In fact, part of helping them open their world is for them to learn to listen to their body and brain, to decide what they can and cannot do. I do not charge for canceled sessions. I personally see that policy as being punitive. If a psychotherapist has chosen, as I have, to have a client base of people with chronic illnesses, these clients have been punished enough by a system that denies Lyme. The last thing a Lyme patient needs is punishment. We have been punished enough in our journeys to diagnosis and treatment. Another important part of psychotherapy is to teach adults and children self-advocacy, empowering my clients to speak openly with family members, doctors, and school practitioners about the symptoms of their illness and what their needs are is very important. Learning to assess who they can be open with is a beginning of learning about boundaries. If a child's favorite aunt or grandparent challenges the child's symptoms with words like, "Oh, come on, dear, everybody gets headaches," there is nothing more empowering than respectfully saying to their loved one, "Grandma, have you ever had a headache so bad that it makes you throw up?" Or, "Do you have headaches every single day?" I teach them that empowerment begins with learning about the disease, deciding who and when to be open to people about it. For example, in a school meeting, they might want to try to respond rather than to react. And I let them know that many adults haven't developed that skill. And even when all symptoms go away, they will have that new ability, decision making, responding rather than reacting, something that can stay with them their entire lives. I remember a fifth grade client. She was small in stature and did not have a strong voice. Despite her physical and cognitive problems, I realized that she was very bright. I learned from her that guinea hens eat ticks, and she had a yard full of them. Part of her job at home was to help take care of the guinea hens. She could accurately pronounce spirochete, in other words, she'd learned since her diagnosis. Took me a long time for me to get the word spirochete pronounced well. A science fair was happening at her school. She came in one day very excited. She had decided to participate in the science fair. I thought that was great. Never did I expect that this quiet young child would do her presentation about Lyme disease and about her having it, thus making herself vulnerable. I asked her how she felt about revealing it to the whole school, kids and teachers. We discussed that fact that there might be kids who were not kind, who began to tease her, accusing her of using Lyme disease as just an excuse to get out of things, like physical education, for example. We discussed it in a few sessions, and she remained committed to educating her teachers and peers. Well, she did it. A fifth grader doing a science project about Lyme and actually having a winning entry. That was self-empowerment. In most graduate schools, psychotherapists learn to start where the client is at. I've learned that in real life, in working with Lyme patients, I start where the client is at each and every session. One session might be about how frightening it was to have to go to the ER when it was necessary. Another might be an appointment with a specialist who judged them and their family and denied their Lyme. Or a primary care doc they had seen for years who told them to leave the practice due to what the doc called their obsession about Lyme disease. I see most of those clients as having post-traumatic stress disorder caused by the way they were treated on their journey to figuring out what was wrong with them. The next part of the talk focuses specifically on how I work with children and their parents. My objective remains the same, to help them expand their view of themselves and their lives. Toward that end, they come to realize that I do not judge them or their parents. My approach is, as it always is, building and maintaining the relationship, enhancing communications and problem solving. With parents, I help them understand the illness. Often it's the mom who does the online research. And in some cases, there is dissension between the parents over how their child's behavior is viewed and what to do about it. The parent who has done the research will have a better understanding of just how much control their child has over their behaviors. A child who is ill with tick-borne diseases may not, for example, have control over when they can fall asleep or wake up. For some, there is a reversal of their circadian rhythms. For others, it is simply disruptive sleep. Without good restorative sleep, there is increased pain and brain fog. As I've heard Dr. Robert Bransfield say in many of his presentations, restorative sleep is essential for healing. Some children do not feel safe alone in their rooms and end up spending all or part of the night sleeping in their parents' room. This is not due to the child's attempt to manipulate the parent. It's due to the night terrors these children have or their obsessive compulsive thoughts and behaviors, especially if the child has PANS. I take these children at their word and try to get to the bottom of what is going on rather than judging the child. With young children, I don't see them without at least one parent participating in the session. One 8-year-old girl was brought to see me by her mother. She was very quiet. That might have been her nature or cognitive problems from Lyme, or it may be that she was having trouble trusting adults since she had been misunderstood by so many adults. On a hunch, I said to her, I'd like to tell you a little about my Lyme disease. Would that be okay? The child and mother said it would be. So I went on, telling them the true story about one of my hallucinations. I said I was in bed with my husband. He was asleep. I was not. I was sitting up in bed when I had this image in front of me that the walls had disappeared and cats were crawling all over me. The mom and child were fine with what I was telling them. So I continued. I was fidgeting, moving around in bed. So my husband woke up abruptly and said, "What's the matter? What's the matter?" I told him what I had seen. And when I mentioned the cats, he said, "Ah, were they cute?" The mom and child smiled, as did I, remembering that hallucination. This is a true story. My family and I are ardent cat lovers. So it was not at all a scary hallucination. I then asked this 8-year-old child whether she had thoughts and stuff coming into her head that she was uncomfortable with. She said there were, and proceeded to tell her mom and me about some of her uncomfortable thoughts. She now felt safe, I believe, realizing that she was not crazy. I remember the day when I had my first hallucination. It frightened me, and I thought I was going crazy, until I met a Lyme patient who disclosed her similar symptoms. Now realizing that hallucinations could be symptomatic of tick-borne diseases, I was then able to tell my husband, my adult children, and other people close to me about what was going on in my head. This is not mental illness, folks. It is what Dr. Charles Ray Jones used to call Lyme encephalopathy, brain infection and brain inflammation. Opening up the channels of communication between parent and child is also one of my goals. One of the clues I have that a child might have Lyme is a sudden drop in school functioning. If there are other symptoms as well, I meet separately with the parents and I suggest that they might see a Lyme literate doctor to check it out. I have found that with the children I suspect of having tick-borne diseases, I am usually right. And those children now have a chance to be treated and get well. Working with kids who have a diagnosis and are in treatment, I set out to support them and their parents in obtaining help from the school. For kids with Lyme, working with the school becomes an important part of the therapy I offer. I teach the child and parents about relevant education and civil rights laws. And if the parents wish, I attend school meetings with them. Time constraints don't allow me to go into education and civil rights law that helps children with Lyme and other disabilities get formal help in school. However, Judy has been kind enough to invite me back to talk about tick-borne diseases in school on Tuesday, September 8th. I hope you can join me again in the fall. I thank you all for being here, and I thank you all for being advocates for yourselves or your children, grandchildren, sisters, brothers, family members, friends. I look forward to seeing you all again.
Thank you, Sandy. I'm going to put the view back on gallery. We are still recording. That was excellent. I hope everyone gleaned a few tidbits from that. I sure did. I do have a couple of questions, Sandy, that have been brought to my attention that I would like to ask you.
Sure.
One of them is, in what circumstances can we reduce our anxiety meds? What coping skills will help them?
Actually, that is that's a big, under what circumstances? I would like to, well, the anxiety meds or the meds for any of the psych meds need to be very carefully tapered off, and they should not be, it's got to be judiciously, and it's got to be done with the aid of medical experts that know about what they call hyperbolic tapering. I suggest that people who are interested in looking into that check out two websites that could give them webinars that are free or $10 that could help them understand the issues with psych meds and psych med withdrawal. One is Mad in America, and the other one is Inner Compass Initiative. And that would be a start. It's really a difficult thing based on how long they've been on psych meds and other factors. So it can't be done by just anyone, and there are other parts to that. So that's a whole other learning thing, and I'm just at the bare beginning of learning that process. I'll never become an expert in that because
Mm.
I've got Lyme to look at, but I certainly want to know for my own sake and to build my knowledge of it.
In children with the ADD symptoms, what's the advice you give to parents? Natural or clearly medication? How it's kind of a fine line because children, at least in this area, our doctors mainly don't believe we have Lyme disease, and it's hard for them to understand that we know there's something underlying why they have the ADD or the chemical imbalances, the OCD. So what advice do you give for those type of symptoms?
Well, many of the doctors talk about chemical imbalances, and if you watch some of the drug commercials on TV, that they also reference chemical imbalances. I'm not so sure that it is about chemical imbalances. I am I have changed over the years. I've changed my thinking about medicating people with ADHD altogether, because you're changing what's going on in their brain, in their little brains. I mean, especially children. I do think that uh, that if even if the doctor doesn't believe, quote, believe in Lyme, which always drove me crazy when a doctor said, even somebody I was seeing for a sinus infection, and I just told them about my history of Lyme. The doctor said, I don't believe in Lyme disease. And I said, it's not a religion, it's an illness. I believe in Judaism. Other friends of mine believe in Christianity or Islam, uh, but it's not a religion. And yet they treat it as though it is. And that's one of my pet peeves. I would say that it's important to take a look at history, exposure, tick exposure, exposure, other kinds of exposure. I mean, where did I get Lyme? We camped every other weekend. We tent camped in the state parks of New York State, mostly New York State, but also out west. We had 3 cats that went in and out at will. And we lived in a development called Deerwood. We had deer running across our lawns. So I would say that anyone, rather than just taking it for granted that it's it's not a medical thing, I would say that it's important to check out what's underneath, where it's coming from. Even if you have genetics for ADHD, I would still check it out. And I would also look at the other symptoms. I would take a look at, there are many symptom checklists around, and it's good to, look at the ILAD symptom checklist, or probably, I don't know, you have a symptom checklist on your website, Judy?
Yes.
Yeah, so and I know LymeDisease.org does, and Monica probably has one, Colorado Lyme. And I don't I would not, with what I know now and not what I knew 30 years ago or 40 years ago, with what I know now, I would be very slow to allow a loved one of mine to go on psych meds.
I agree with you.
I know that's extreme,
Yeah.
but that's how I feel.
I agree. Let's see, I have a couple more. Let's see, what is the youngest child that you've treated? And are your protocols different for different age groups?
Uh, well, I thought I went, first of all, um, I respect the Lyme literate doctors and nurse practitioners
Okay.
and um I um so the treatment of the disease and or diseases is in the hands of those doctors.
Mhm.
If I have something to say to the doctor, I might contact the doctor and say, gee, I'd like to understand, um, kind of what your thinking is about where you're going with this child's treatment so that I can help support your protocol. Um, so I don't treat Lyme. I I uh, I I don't even, I kind of don't call it treatment. I talk about working with
Mhm.
my clients. I never call them patients. They're not my patients, they're my clients. And our roles are different. I know things they don't know, like this little girl who was in 5th grade. Um, I know things that she doesn't know, and she knew things that I didn't know. Um, and so I believe that although our roles are different, we are working as a team on getting her better, or whoever the kid is. I have never seen a kid under the age of 8. They have to be verbal in
Mhm.
order for me to work with them with the way I work. I don't do play therapy and that kind of thing. I'm not sure how effective play therapy would be for a kid with infections that are behind their symptoms. Uh, that's so. I don't know. Did I
Yeah,
answer the question,
yeah,
Judy?
I think so. I think so. You mentioned that PTSD after a long battle of not being believed. Um, let's see. Any suggestions on how to help someone reestablish trust in medical providers? That's a hard one.
Yeah.
Because we've all been told, I mean, I'm thinking in our own situation, and especially in the Kansas City area, we've all been told that Lyme disease doesn't exist. One of our members has said that he was told that we have it in Missouri, but we don't have it in Missouri, we have it in Kansas, or vice versa, because we live on the state line. So, how can we reestablish trust in our medical providers when they've just basically not helped us?
That is a difficult one, and let me tell you, Connecticut is the home of Lyme, Connecticut, where it all started. And we have an awful lot of doctors that also don't believe in Lyme. I've had some of my own, as an advocate, some of my own battles. One of the big battles um, led to my co-chairing what turned out to be the first annual Lyme Disease Association conference back in 1999. And none of the doctors in Dutchess County, New York, where I then lived, came to it. But yet they were coming from other parts of the country
Mm.
to this 2-day conference. It was an amazing conference at Bard College. And there was a stubbornness uh, uh, um, and a lack of openness, open-mindedness with some doctors. So it's important to know what you're trusting your doctor for. Uh, well, I left one pediatrician long before Lyme when I had my 3-year-old and my 2-year-old at that point. They're now in their late 50s. And and this doctor said something about oh, boys, they just go on and do stuff and they don't complain when they have an ear infection. Little girls are different. They're complainers. That was the last time he laid eyes on us.
Mm.
He said that right in front of the kids. So I'm not one that that accepts everything that doctors say. Going way back. Uh,
I find that interesting that you say, and it's good for the people in Kansas City to hear that, because we are told a lot that, oh, that is on the East Coast. It's not back here. And then yet on the East Coast, you have doctors as well who will not treat because they don't believe in it. That's interesting.
yeah, oh, we do. I had one, I was referred to an ear, nose, and throat doctor because I had a sinus infection. And I was referred by an osteopath, a classical osteopath that was helping me, that was treating me. And I walked in and I was so proud of myself. I'm computer literate. I had my whole medical history on a sheet of paper, handed it to him, and said, I'm here about sinus infections. And he said, I see Lyme disease here. And he got belligerent right from the beginning. And he said, what makes you think you had Lyme? And I said, I figured, let me talk about the one symptom that classically everybody knows that Lyme causes. So I said, well, among other things, I had a really bad Bell's palsy. You can still see, doctor, the remnants of that Bell's palsy on my face. And he said, that's atypical Bell's palsy. It has nothing to do with Lyme disease. I was out of there so fast. And then when I went back to the osteopath, he said, I thought he was a good doctor. I'm never referring to him again. So sometimes your best advocates for your own well-being are the pharmacists. I know that you know of one of them that you mentioned before.
Mhm.
So the pharmacists, the osteopaths, the chiropractors, different people that sometimes the nurse practitioners know what the doctors that they collaborate with do not know. So I just say I have a primary care doctor that's not Lyme literate, and he's fine as a primary care doctor. I know what what I'm doing about my chronic Lyme, and I just don't discuss that with him because
Mhm.
there's no point trying to educate somebody who doesn't want to be educated.
You're right.
You know?
That I think that's all the questions I have, except I do want to share, and I don't know if you want to expand on this. I know it's getting late for you. Um, I put in the chat, everyone, that Sandy's website is limefamilies.com, and you can go about and read all about her and what she has done and what she is doing. I think she's just instrumental in with our schools, helping our educators and our administration to understand um, how kids behave and what symptoms to look for and things. I know here in the Kansas City area, Our Vice President, Leslie, did a great job. We put packets together and we delivered a lot to the schools here in the area. I think we're probably due to do this again sometime if we can get volunteers in our area to help us out with this. But this affects children and adults, doctors, parents, they just don't understand. And so go to lymefamilies.com to read more about Sandy. I'm going to show you just briefly. Okay. Oh, actually, I'm going to go ahead and stop the recording if that's okay. And then I can screen share something, Sandy, on your website. Is that okay?
Yeah, that's fine. Just to say that the what you're going to screen share are documents that are on my website, and I'm happy to have
Yeah.
anybody print them out and hand them out if they find that it's helpful.
Yeah. Sandy has given us permission that we can give out her information, and that's very helpful. Okay, now I'm going to see if I can stop the recording.